Hi friends, today's second business standard editorial is titled Effective Oversight, and it is talking about an beautiful topic of weight loss drugs. In India, on March 20th, the patent of the blockbuster weight loss formulation Semaglutide expired. This formulation belonged to the Danish pharma major Novo Nordisk, which was sold under the brand names Ozempic and Wegovy. Indian pharmaceutical companies such as Cipla, Sun Pharma, Dr. Reddy's Laboratories, Biocon, Natco, Zydus, Mankind Pharma have been ramping up their manufacturing capabilities and waiting for this day so that they could release their generic drug versions of the weight loss drug. Generic drugs are pharmaceutical products that contain the same active ingredient as brand name drugs, in this case semaglutide, offering identical therapeutic effects at a lower cost. They become available after the original drug's patent expires. Indian generic drug manufacturers could cause the semaglutide formulation containing drug prices to plummet 50 to 70%. The Novo Nordisk Ozempic costed 8,800 to 11,000 per month, and the Novo Nordisk Wegovy costed nearly 10,000 to 17,000 per month. Indian generic drug manufacturers' major export hub is Europe and US, but there the patent on semaglutide is still active and it will expire only in 2031. The success of Indian generic drugs in the domestic market, that is in Indian market, will determine their ability to break into the lucrative markets of the West when their patents expire. So why in India did the patent got expired early? India grants product patents for 20 years from the filing date under the Patents Act 1970. Unlike the US and European Union, India offers no patent term extension for regulatory delays, limiting the protection to 20 years from filing. Regulatory delay means if after filing a patent, a company submits a drug to the regulatory authority for approval. To get the approval, some time will be lost, some months or some years. So along with in addition to the patent duration, this lowest duration will also be compensated in Europe and US, but in India only fixed 20-year term is there for the patent protection. The firm that holding the patent, when its patent expiry is nearing, they often file a secondary patent without doing much changes. Like they just change some minor formulation tweak just to deter the generic manufacturing companies from making generic versions. This process is called evergreening. In India, the law rejects evergreening unless the new patent demonstrates that the new patent significantly enhances the therapeutic efficacy. If Novo Nordisk filed the patent in 2006 itself, then why did the weight loss drug become mainstream only recently? Now this is interesting. It is because the drugs that are currently weight loss drugs were first developed and approved for type 2 diabetes. When they were actually giving the medicine for type 2 diabetic patients, they have identified a beneficial side effect of weight loss. When they identified that this weight loss was a beneficial side effect, they concentrated their research on making a drug or tweaking the drug so that it is made only for the purpose of weight loss, and that is how the weight loss drug came into existence. For example, Novo Nordisk introduced Ozempic as a treatment for diabetes, and Wegovy was the drug they tweaked to be an drug for obesity treatment. It was approved only in 2021-22. Nearly all other major weight loss drugs that exist currently were also first developed and approved for type 2 diabetes, with weight loss emerging as a beneficial side effect that later led to the higher dose obesity specific approvals. Just like Novo Nordisk company and its semaglutide formulation, which are the other companies and what are their formulation? Eli Lilly is an US company. Its formulation is called tirzepatide, And the first drug introduced as a diabetic treatment was Mounjaro, and the modified drug for obesity treatment was called Zepbound. Again, for Novo Nordisk, they have another formulation other than the semaglutide, and that is called liraglutide. And the first drug introduced as a diabetic treatment was Victoza. Later, when it was identified it was having obesity treatment capacity also, that Victoza was modified into Saxenda drug. So Novo Nordisk, a Denmark company, and Eli Lilly, a US company, are the two major players in the world of weight loss drugs. Other companies include Pfizer, Roche, AstraZeneca, Sanofi, Amgen, and so on. Coming back to the Indian generic weight loss drug, these Indian companies are looking at a major addressable market in India because, as per National Family Health Survey 2019-21, 24% of Indian women and 23% of Indian men are overweight. In addition to this, 77 million Indians suffer from type 2 diabetes. Now, as we already discussed, the drugs has the capability to treat both diabetes and obesity. So this makes India a potential market for the weight loss drug, and now the generic version of the weight loss drug. Both obesity and type 2 diabetes are lifestyle diseases, which means this is a byproduct of inadequate exercise and unhealthy diet. Lifestyle disease treatment market in India was just 16 million in 2021. It grew to 100 million by 2025 at a 58.11% CAGR. By 2030, it is again expected to grow 8 times to nearly 800 million US dollars. Now, the major warning for India: with easier accessibility and greater affordability comes the question of quality. Quality of the generic drugs made by Indian companies have recently been questioned. Indian manufactured cough syrups recently caused the death of children in Central Asia and Africa. This also points fingers towards the gross inadequacy of drug regulation in the country. Had the US and European markets been open to the Indian generic weight loss drugs, then the imposition of global standards under bodies like US Food and Drug Administration would have ensured minimum standards of safety. Now that is not the case, then the Indian manufacturers bear the responsibility for the quality of the generic weight loss drug, especially when the main manufacturer subcontracts the production due to increased demand. Estimates suggest that nearly 28% of the drugs available in urban India could be spurious. Majority of them are high demand, high value drugs for cancer treatment and cardiac treatment. Now, the weight loss drug could also enter that notorious list. The second biggest risk is that Indians have a natural tendency to self-medicate and buy the medicine as per her wish from the nearby medical store. This must be avoided because medical practitioners have warned that weight loss drugs need to be administered with a strict diet and proper exercise if it is to work effectively. That is, it must be taken under strong supervision only. In summary, even though the generic version of the weight loss drugs makes it affordable to the vast majority of Indians, the Indian drug regulators and the medical community have to ensure best quality of the drugs and give proper health advisories to the public. Thank you.